Hello, everyone. Thank you so much for joining us today. I always do like to start these monthly advocacy chats with a show of gratitude. And I'm even though I have seen this video before, seeing it again just really just makes me choke up a little bit because that video shows what we're always talking about within COA and CPAN is that cancer does not just affect the cancer patient, it affects the family. And you saw that by the cancer patients describing that they weren't even thinking only of themselves, they were thinking about their family members. And then to see the Dr. Finkelstein, she used the word despair, and those are just very real feelings. So, thank you all again for being here. I have to compose myself just a little bit after seeing that again. It still triggered something in me. But I want to thank you for being here. Thank you. Some of you may have seen a little bit of a glitch in that video, but as I always say that even though we're a year into the pandemic, technology has a way of challenging us every time, even though we do all our prep work and try to always do everything seamless, sometimes there's little bumps. And also here I go with the thank yous again, but thank you for all of you that joined our annual conference last week, and it was virtual. It was extremely well attended. We had over 3,000 registered attendees. And I think it was worth everybody's time. It was 2 days of action-packed information. I say action because our speakers get very animated and we do a great job, a little pat there, of bringing in not just one-sided views. We bring in speakers that are, reflecting different viewpoints because again, that is how we learn. So the conference covered everything from biosimilars to legislative updates, to clinical information on lung cancer. And my favorite session was defining the value of cancer care. And that session was designed to, again, show different perspectives, a patient perspective, an employer perspective, because oftentimes we don't think about the employer's role in cancer care, but for many of us, they are the insurance providers. So they're very interested in what's happening in cancer care as well. And we had a patient perspective, and I was very proud of our patient advocate, Tommy Ramey she's one of our most dedicated CPAN advocates, and we have hundreds of them across the country. So I wish I could give them all a place to be on a panel, but they're out there, and she did a really great job talking about what value means to patients and how patients define value. So that wonderful video was a sneak peek into well, you got a sneak peek at the conference, and then you got another video. So we believe in repetition, and anyone who's worked in media and marketing, that you have to say things a couple of times for people to retain it. So we told you, gave you a sneak peek at the conference about our big national campaign. You just saw a video about it, and that's obviously our topic. But what's one topic we're all tired of talking about, but it's still part of our daily lives, and that's COVID. So I have to talk a little bit about COVID right now because we're all still dealing with COVID. And even though we're very optimistic, many people have received the vaccine, those who have chosen to get the vaccine. But what did happen is that everything came to a screeching halt during COVID, right? Everything changed. Our work lives changed, our home lives changed for children and college students, their education changed. It's just been a big, crazy world for the last year, almost, it's a year and 3 months now. And one of the really bad things that came out of COVID is there was a lot of bad that came out of COVID, but we're trying to be optimistic today. But something that was a very real concern, and again, we do like to bring you the facts here, is that our oncologists and cancer centers across the country started noticing that there was a dramatic decline in cancer screening. And as we've talked before, we've had other guests that have mentioned this topic, it made sense that there was a decline because we were all so scared of this unknown virus that people didn't want to go to their doctor, myself included, because we were scared. We didn't know if where we were going was going to be safe. We didn't want to be around people that weren't, wearing masks if it was in a medical facility. But what many of our speakers on these advocates have shared with all of us is that they educated all of us about what they were doing to make their cancer centers safe. And keep in mind that cancer centers pre-COVID were already one of the cleanest, safest places you can be in. But after COVID, they became even safer, an even safer, cleaner environment because all of our cancer centers were very good about being extremely strict and rigid about adhering to the protocol, the safety protocol guidelines that were developed for COVID-19 that were set out by the CDC, which is the Center for Disease Control. And even though we like to talk about how great community oncology is, it wasn't only community oncology that had safe medical facilities. It was many other medical facilities. And our two speakers today are going to tell you a little bit about that. And who are these two speakers? Well, they are Nick Ferreyros, our very own Director of Communications, and many of you heard Nick moderate a few sessions last week, and so many of you do know who Nick is. And we're also very happy to be joined by Marissa, who is the Director of Specialized Programs at CancerCare, another phenomenal cancer organization that's been around for many, many years. And this is going to be another partnership that we've done with them. And they're going to go more in depth about what we're doing, because with COA, especially under our director, Ted Ocon, we're always looking forward, trying to be solution oriented. And when our oncologist, our membership was coming back and reporting this dramatic decline, we're talking about a 75% decline for colon cancer screenings last year and 85% decline in breast cancer. And again, and I do want to look at my little paper here because I like to give you accurate information. You can find these studies. One was conducted by Avalere Health, and it was on COVID-19's impact on cancer care. And that was published in October in the Journal of Clinical Oncology. And also, speaking of prestigious publications, this issue was so important, the decline in cancer screening and what it means. What does it mean if people don't go to see their screenings? Well, anyone who's a cancer patient, or, I hate to say it, many of us don't know if you're going to get cancer in the future. If you detect cancer early, you have more treatment options. So for the New York Times also to pay attention and give this prominent space in the New York Times, there's a very in-depth article about the screening campaign. You can find a lot of these articles on our website as well. And I'm very happy to say that 4 of our doctors, Dr. Patel from Carolina Blood and Cancer in Rock Hill, South Carolina, who's also the CEO and our current board president, Dr. Lucia Gordon, Florida cancer specialist, was quoted in there. The patient that you saw with Dr. Patel, Loretta, I believe is her name, is profiled in the story as well. Dr. Rao and Dr. McEnany, all frontline practicing oncologists. So I encourage you to read those stories. If you can, again, you can Google that New York Times article or find it on our website. It was on March 17th. And before I turn it over to Marissa and Nick, really, I truly really mean what I say. Please take the time to look for that New York Times article, because it profiles some patient stories, and not every patient story has a happy ending. And it's really sad, but that shows you the importance of the topic that Nick and Marissa are going to educate us on about today. So Nick and Marissa, thank you for being with us today, and please share your knowledge with us. Nick, you can start.
Sure. Thanks, Rose. Hi, everyone. Nick Ferreyros, Director of Communications at COA. Sorry about that tech snafu. It's a running joke at COA that I don't know how to unmute myself during webinars. And this would be about the 4th time I've done that. So, we can all laugh about it, because that's the era we're in. But of course, COVID-19 has brought a lot of things for us to laugh about, but also a lot of things for us to, to reflect and mourn about as well. And hopefully one thing we're trying to avoid is more cancer incidents or worse cancer incidents and outcomes. And that's what prompted this campaign. As you know, COA represents independent oncology practices and physicians. And one of the things they started to see a few months into COVID is a dramatic decline in cancer screenings. And what you see here, I'm going to show a few charts to sort of put that in context. This is the relative drop in screenings from 2019 versus 2020 for the March to November period of last year. Last April, a year ago, we were, I'm in New York, Marissa's in New York. We were sort of at the epicenter of the hot spot when this all got started. And lockdowns started happening, and it got really bad. And you can see what happened here is, breast, colon, lung, and prostate screenings dropped an average of 76% last April. Cancers didn't disappear. They were still there, but they were just not being screened. And, we've got a long history where we can look back and say, we know that these numbers of cancers are coming. We know what's in the pipeline, unfortunately. And that's a very scary thing for a doctor to see, is to see a nearly 80% drop in screenings. Breaking this out specifically to each cancer type, you can see here in April of last year, year over year from 2019, an 87% drop in mammograms, 73% colon screening, 75% for lung cancers, 57% for prostate. Now, it got a little better over the months. You can see that the drops were less dramatic, but still, you get to June where you started to see mammograms picking up from the year before, but you still have a 20% drop in colon screenings. And then, of course, as the second waves started to kick in later into August and September, October, they dropped again. And we have new data. This goes through November of last year, but we have new data looking into December, January of this year, and it's still, roughly an average of 25% drop. So, let's look at these. You look at these months, 20 to 30% drops in all these major cancer type screenings. Again, the cancers didn't go away. So 1 in 5 of these of screenings were missing during these months. That's a long tail for us to pick up on. And we've been screaming about it. That CBS clip earlier, that was one bit of what we did. We also have this New York Times piece that Rose has been referencing. This is a catastrophe in the making, and we're very concerned about it, and have been trying to figure out what we can do about it. Now, of course, at COA, we're overachievers. We don't just tell you about problems, but we try to come up with solutions. And we have been working very hard to do that, and that is the Time to Screen campaign, something we're very proud about. And the idea is to very firmly send out a message of encouragement to Americans that detecting cancer early may save their lives. It's safe to do so now, and we can help out with that. This is a very proud collaboration between COA and CancerCare. We've worked with CancerCare for a number of years. I know I've been at COA for almost 6 years now, and we started off 4 years ago, I think, with dealing with hurricane relief in Puerto Rico, where the majority of cancer care is delivered in the community oncology setting. We also helped out last year with a sort of an immediate Band-Aid, if you were, on helping patients get transportation to their appointments. So, we're very proud to work with CancerCare and continue that collaboration. As I said, Time to Screen, it's sort of a 3-pronged approach. Education, that's the most important thing, is an informed consumer, educating about the importance of cancer screenings. We all know that they're important, but emphasizing that. Providing solutions, not just telling you there's a problem, but helping you solve that problem. And then emphasizing that things are safe right now, that screening locations are taking this seriously. They're social distancing, they're enforcing mask use. The vast majority of the healthcare workers there have been vaccinated. So there's a lot of safety and safety protocols that have been going in, particularly now that we're 14 months into this pandemic. I want to take a moment, to say how we came to that point. Well, we did some research, and thanks to our CPAN advocates who lent their voices here, we did focus groups with them on how should we position this campaign, what is most effective, because we are in a lot of ways in the weeds with cancer care at COA, and we think we know, but it's always important to have research and validation for what we're doing. So we talked to CPAN advocates on some focus groups, and really drilled down into what were effective messaging. And that came out to be empowerment, safety, and ease. And the empowerment message is very important because we know that telling people, oh, you've been bad and you did something wrong and you need to fix that, that doesn't work. That doesn't work in public health messaging. It doesn't work in this campaign. We need to be more positive about this and tell you can solve this problem. Emphasizing the safety, again, that was something we heard many times. And then the ease of solving this problem with our campaign. So Time to Screen, The core of it, this is really the most important thing, is the hotline that Marissa and her team at CancerCare run, 1-855-53-SCREEN. And that is a very, we bounce that around a lot. That is a very memorable number. It's easy when you do radio and TV. And patients or individuals can call in and get help in identifying a screening location and finding a place to go. There's also our website, timescreen.org, where you can get education on why screening is important, as well as emphasizing all of our sort of key campaign elements. And then, Marissa put in a ton of work at the beginning of our database of screening locations that help patients with all different cancer types when they call in to the 1-855-53-SCREEN number. And identifying them depending on their insurance. There's a lot of different ways to help people, and that's the solutions. These are all solutions that we want to provide, because again, just pointing out a problem doesn't do that. The campaign will also work with, we have a very deep network at COA and with CancerCare and with CPAN advocates and so on, and activating our communities, reaching out to them. Partnering with other clinicians, so primary care providers, the screening locations, and also employers. They are an important audience. They're very worried about their employees' health and well-being, and they want to get screening back on track. And then also tapping into local markets. We will be doing this in a lot of different ways, but really, public service announcements and public awareness. So a lot of advertising. We've got a great celebrity spokesperson in the works. I'm not at liberty to share just yet, but that'll be coming soon. Public service announcements on TV, on radio, online, lots of different ways in which we're going to get this message out. And then media outreach, which we already started, as you saw, with that CBS News and New York Times pieces. Just a few examples of what this might look like, Instagram, Twitter, your bus stops, displayed digital ads. So, it's a 360-degree campaign. We want to reach out to as many people as possible in as many different ways. Of course, this doesn't happen in a bubble. We are proud of the supporters we have for this, and we want to thank them for it. It's important to emphasize this: all of the content, all of the work that goes into this is independently developed by COA and CancerCare. These are just helpful funders for the campaign, and we thank them greatly for it. But they recognize how important of a public health message this is to get out. And with that, I will turn it over to Marissa to talk a little bit about CancerCare.
Marissa, let me jump in really quick. Just to the audience, we try very hard to keep these to 30 minutes, and we have a very, very high track record of that. But we do run into some difficulty sometimes. So I really encourage you to stay with us, because Marissa has some great information to share. So Marissa, please take it away now.
All right, great. Well, thank you so much, Rose and Nick. And it's a pleasure to be here. Thank you again for having me. And I'm really here today, as I am overseeing the call center side of Time to Screen, which I will definitely take a deeper dive into. I'd first like to talk a little bit about CancerCare and our services. And, I could talk all day about CancerCare and the work that we do, but in the interest of time, I will be brief in my overview. So CancerCare is an organization that has been in existence now for over 75 years, 76 now. We're based in New York City, and we have offices in New Jersey and Long Island. Our mission is to provide assistance, to provide help and hope to anyone impacted by any type of cancer. That includes, not only the person diagnosed, but also their family, loved ones, caregivers, and the bereaved. And we're an organization that is really dedicated to providing professional support services, including case management, counseling, support groups, educational workshops and publications, and financial assistance, and all free of charge. And many of these services are actually provided by master's prepared social workers. And I am thrilled to have this opportunity to have a continued collaboration between our organizations and, like you said, provide solutions in times of need. So I'll chat now a little bit and move forward to discuss the Time to Screen helpline. I'll talk about what we've been addressing on the helpline, what to expect when somebody calls, and provide some examples of just how we could help. So as you've already pointed out, COVID-19, of course, has had a tremendous impact on people's lives, and Time to Screen is a direct result of this impact and really the changing fears or concerns that are generated from navigating all facets of life, including accessing healthcare. And I think it's also one that's now we have to address those fears of exposure to the virus and how to keep yourself safe. But also, you're concerned about how to keeping your loved ones safe as well. And really, just paired with this national campaign, the Time to Screen helpline is ready to help navigate this world, provide guidance and assistance, to get people screened now and really how to do it safely. We provide that message of urgency, and with the CDC's guidance and safety protocols, we can really stress and reiterate what you can do to stay safe, but also what is your healthcare team doing to keep you safe? That's all through mask wearing and social distancing, avoiding overcrowding, and really adhering to cleaning protocols. And I think these conversations, really this opportunity to have a dialogue is really so important. When many people, they were or really still are concerned and putting off their screening. And, I think it's in some cases definitely understandably so. It's confusing. It can be very scary. When you call the Time to Screen helpline, we want to address that anxiety and help you find ways to overcome that. Also, education and empowerment are definitely key. We're equipped to provide information on the types of cancer screenings themselves. For example, what to expect when you go in for a mammogram, or how to prepare for your colonoscopy, or how to better communicate with your doctor to see if even prostate screening is right for you. It's that combination that will promote, taking charge of your health while, making it a priority. And, like Nick said, we aim to provide solutions, just to make it easy to find screening programs, locations. We need to identify, different paths to find information. So, for example, there are some people that do have insurance, and there are people that don't have insurance. And it's really important to recognize that because, if people do have insurance, we want to help them navigate how to find in-network providers, how to navigate healthcare systems to feel more comfortable with their appointments. And if someone is uninsured, we want to find programs in their area that offer reduced cost or affordable care. Which leads me to talk a little bit and briefly about barriers to screening and health disparities. So, of course, COVID-19 has become a crucial barrier to receiving care and screening, and the primary contributor to declining rates of screening over the past year. However, we must take the time to identify what other barriers may be factoring into having access or not having access to screening. We must be aware of possibly intersecting concerns that a person might have. And we know that there are populations that are disproportionately affected by health disparities, whether that's because of race or gender or age or location, just to name a few. I think COVID-19 has highlighted that these barriers and disparities exist, especially in the healthcare system. So we have to be aware of that fact and we have to take the next step. If there are unequal distribution of resources, we need to address that. One way to do that is to help understand how to educate or empower people, to get the access to the resources that they need. And you do that by committing to helping underserved populations or vulnerable populations, basically by having culturally competent practice. And this is something that's been inherent in cancer care programs and will continue with the service as well. And then finally, just bringing it all together full circle, I just want to highlight the access to cancer care services and programs that these callers to the Time to Screen helpline will benefit from and will have. Whether they're calling as a cancer survivor in need of screening or diagnosed through these screening efforts, all these callers through the Time to Screen helpline will have direct access to the free services that I mentioned before, the case management, the counseling, financial assistance. And I think it's this connection, this linking of services that really makes it such a comprehensive service. So I'll end there, and thank you again to everyone. And I'll just say now back to you, Rose.
Thank you so much. I'm thinking everybody's familiar in the cancer setting with oncologists and nurses, but I think there's this, not too many people are aware of the oncology social workers and what incredible work you all do. I mean, because not every cancer center has the benefit of oncology social workers. So it's wonderful to know they can also access them through CancerCare. Nick and Marissa, really great information. And Nick, I just want to go back to one of your slides really quick where there was the empowerment slide. And you mentioned how this campaign is all about being positive. So the fact that, people didn't get screenings, that no one's bad in that process. What we tried to convey today is we understand we were all living the same experience with you. We were all scared of COVID as well. But hopefully today you learned that this campaign is going to reassure everybody that the cancer centers and all the medical facilities and all these great organizations that we do partner with are doing everything to make your cancer experience or prevent a cancer experience from happening. Just giving you education and good information. So thank you so much. And one last important thing is next month topic is going to be clinical trials. It's National Clinical Trials Month, and the community oncology setting is where a majority of clinical trials are also delivered. And that should be no surprise since community oncology treats the majority of cancer patients. But there's a great myth that, you can only get clinical trials in academic settings. So our special guest is going to be Katie Goodman, who is the Vice President of Clinical Research at AON, and many of you know her from her former role as a senior leadership person, VP at Florida Cancer Specialist. And I opened up by talking about our virtual conference, but I'm so excited about this, getting things back to normal. If you didn't attend our conference last week, you might have missed this, but drum roll please, our conference next year is going to be live again, and I'm so excited. So save the date. It's March 17th and March 18th. It's going to be at the Gaylord Palm in Kissimmee, Florida. Please come into the advocacy room and say hi. Look forward to meeting you. Thank you for your time today, and thank you, Nick and Marissa.
Bye.
Thank you.
Thank you.